Good afternoon, everyone. Thank you for joining us. I'm joined by Colorado Department of Public Health and Environment Executive Director Jill Hunsaker-Ryan, Colorado's COVID-19 Vaccine Campaign Manager Tara Trujillo, and Brigadier General Scott Sherman, recently back from overseas to talk about the monumental effort and collaboration between communities across our state to help make sure that Colorado was, in fact, one of the states that achieved the president's goal of 70% of people 18 and up with their first vaccine by July 4th. We beat it by a couple days. We certainly have a long way to go. With regard to 12 to 17-year-olds, we are currently at 42.8% protected, or at least with their first vaccine. And of the 3.1 million Coloradans who've gotten vaccinated, look, we're going to be giving out some prizes here today, but every single one of you is a winner. And if you want to be a winner and you haven't been vaccinated yet, get vaccinated, get protected. It saddens me so much to see that there's 284 people hospitalized in Colorado from the virus. There are hundreds of people dying every day in the United States, tens of thousands across the world, and it's unnecessary. When the pandemic started, there was little we could do besides alter our behavior, wear masks, try not to overcrowd our hospitals. Now we can do a lot, and that is protect ourselves. The vaccines are highly effective, and even when people who are vaccinated get COVID, it's a much more minor case, much lower cases, much lower rates of hospitalization. So let's end this pandemic once and for all right here in Colorado. Let's all be winners. If you haven't had the chance to get vaccinated yet and protected, please do so. And we have a lot to celebrate in Colorado. On Saturday, July 3rd, we were at 70.04%. That's before vaccines from the third and fourth were even added into the database. They're added as we speak. It's an important milestone. The last year and a half has often felt like an uphill battle. But reaching 70% with the first dose of adults means that we can take a minute to reflect and all breathe a little bit easier. Yes, folks who got the first dose still need to get their second dose. Yes, there's still a lot of folks who still need to get vaccinated, but we wouldn't have been able to achieve the president's goal without the hard work of our COVID-19 response team. And I want to thank Jill Hunsaker-Ryan, Stan Hilke from the Department of Public Safety, Tara Trujillo. I want to thank the Colorado National Guard. Brigadier General Sherman's here. I also want to thank General Laura Clellan. The Guard ranks with so many National Guard members across the country that answered the call of service, whether it was testing, whether it was logistics for large-scale vaccination events, masks, PPE, helping those in need. We all got through this better because of the hard work of the Colorado National Guard. To our leaders in local public health agencies, mastered hybrid schedules, found ways to get folks vaccinated. Our local public health authorities continue to do a great job rising to the occasion, and I thank you for that. And to everybody who's helped this historic undertaking of a vaccination process, thank you. You may have volunteered your weekend days. You may have come out of retirement. You may have taken a job and been paid at one of the vaccination sites. You may have volunteered to work at your church or community center to help people check in. I just want to say thank you. This was a historic undertaking to vaccinate over 3 million Coloradans in just a few short months. We've really never mobilized around something that's brought us together like this before. And on behalf of the state of Colorado, I want to say thank you. And a message to those who haven't gotten around to being vaccinated yet. Virus is still with us. Highly spreadable variants that are potentially even more dangerous, like the Delta variant. It's a majority of cases in many parts of our state. But the vaccines work against the Delta variant, against all the known variants. And there's a very simple step you can take to keep yourself safe, your family safe, our community safe. And that means just get vaccinated to keep the wins coming and make sure that you are here for many years to come. This graph shows the number of vaccines administered each week, adjusted by a state's population. States that announced vaccine drawings seem to be on the upper end of the states with vaccines. So these are states that announced it early. We'll have an updated version of this in the next few days, but you can see that the states that implemented through the month of June vaccination plans with drawings and did see a higher rate than states that didn't. And there's really a lot that we are working on with regard to vaccinations. Public information campaign, community stand-up clinics. We have 8 mobile stations that are going across the state to any event with people to give people vaccinations on the spot. We know it'll be a lot harder to get from 70 to 80 than it was to get from 0 to 70. But with your help, we will do it. And we know that we're not going to change anybody's mind. There's always going to be a few folks that don't want to get vaccinated. But by and large, we know that there's folks out there that have just been putting it off, don't want to think about it, unpleasant, don't want a sore arm, don't want to worry about being under the weather the next day, or work 2 jobs and can't find time to do it. And I get that. But now's the time to really step up for yourselves, for Colorado, for our community, to end this pandemic. We see a much higher rate of COVID-19 in the areas of our state with lower vaccination rates. And we see negligible COVID-19 in the areas of our state that have successfully achieved 80-85% vaccination rates. So that bright future is there, and together we can reach it. We'll now hear from Colorado Department of Public Health Director Jill Hunsaker-Ryan.
Thank you, Governor. Good afternoon. We've reached a remarkable milestone and could not have done it without the tireless work of the employees at the Colorado Department of Public Health and Environment, Colorado's 53 local public health agencies, our health equity partners, vaccine providers throughout the state, and you, the residents of Colorado. We've worked in constant collaboration with local public health agencies who've administered nearly 500,000 doses of vaccine. We've worked to have distribution sites across the state to meet the needs of people where they are, and we continue to provide mobile clinics in the form of buses and vans in rural communities and neighborhoods identified as vaccine deserts, those with the highest numbers of communities of color and those living in poverty. And incidentally, the buses have made 385 stops so far. Additionally, we continue to organize pop-up clinics in partnership with community-based organizations to address disparities in vaccination rates among groups, including communities of color that have been disproportionately affected by COVID. We are also coordinating with transportation providers to assist Coloradans with mobility barriers or without a personal vehicle. As the virus continues to evolve, with new variants, we are committed to providing the latest information on vaccines and will continue to make vaccine access easy for all Coloradans in order to achieve widespread community immunity, because it's the way back to the Colorado we all love. Thank you.
Thanks, Director Ryan. I also want to welcome Tara Trujillo to talk to you about what comes next, because as I said, we're going to work to get from 70 to 80, and we know it's going to be harder from getting to 0 to 70, and we want to make sure we protect a much more higher number of the 12 to 17-year-olds. And also, I'm a father of a 9-year-old and a 6-year-old, and I am very excited. In particular, our 9-year-old son is very excited when the vaccine becomes available for the next group of young people, 6 to 11-year-olds, which we hope will happen late summer, early fall. I want to thank you, Tara, for your help, and I'm excited to turn it over to Tara to walk you through what the COVID-19 team is focused on going forward. Tara?
Thank you, Governor. I'm Tara Trujillo, Colorado's COVID-19 vaccine campaign manager, and I'm so proud of our work so far. 7 out of 10 adults in Colorado are now vaccinated with at least 1 dose of the vaccine. We are thrilled to have reached this milestone and grateful to all Coloradans who helped us make it there. Because of you, we are getting back to life as we knew it before the pandemic. Our team is working to reach people where they are, offering as much convenience, access, and information as possible to remove any remaining barriers to vaccination. We are making phone calls, sending text messages, sending mail to people's homes, and taking our vaccine buses across the state to make sure that every Coloradan can access a free and convenient vaccine, and to ensure their questions are answered and their concerns are addressed. We are proud to be among the top states to have reached the milestone of more than 70%, that's 7 out of 10 adults who are vaccinated now in this state. That's more than 3.2 million individuals with at least 1 dose of the vaccine. We are committed to narrowing the gap of Coloradans who haven't been vaccinated yet. Our next major goal is to help kids aged 12 to 7 get protected against COVID-19 just in time for back to school this fall. Thankfully, the Pfizer vaccine is safe and effective among the age group, and clinical trials and real-life data show that it works extremely well to make sure that children don't get sick with the virus. So far, nearly 200,000 young Coloradans have taken at least one dose of the vaccine. We know that teens and their families may have questions about the vaccine. It's important to be curious about anything this new, especially after a year where we've had to take in so much information. That's why we're working to enroll primary care doctors, more pediatricians, family practices, and clinics in our vaccine program. We want to make sure that teens and their families can have conversations about the vaccine with doctors they know and trust, especially as we start to get ready to send our kids back to school. We are continuing to do everything we can to make sure that all Coloradans have access to reliable information about the vaccines so they can make informed choices about their health. For those who choose to get vaccinated, we're working to make sure that it's as easy and seamless as possible, especially for people who have historically faced unjust barriers to health care. We know that COVID-19 has impacted these communities harder, and we know that we need to work harder to make sure that everyone in Colorado who wants a COVID-19 vaccine has access to one. Right now, there are free vaccines at hundreds of providers in all counties throughout the state. That's 64 counties. No ID, no insurance, no appointments are needed. We are working to make sure there's a vaccine for you in your neighborhood and it's nearby. We are closer than ever to putting this pandemic behind us, and with your help, we'll get there. Thank you.
I also wanted to highlight in the Pfizer data that's submitted to the FDA, the vaccine in the trial group of 12 to 17-year-olds was actually 100% effective, which is almost unheard of in preventing symptomatic COVID-19. For folks my age and other ages, it was more in the 90 to 95% range, also very good compared to other vaccines, better than measles, better than many other vaccines, but even higher rates of protection for 12 to 17-year-olds, which is very exciting news and an extra reason to make sure that you go out and bring your kid to go get it at your local pediatrician, your local Safeway, your local Walmart, wherever you happen to be, that they're offering the vaccine. Very easy to do, free, no matter where you are. You don't need to be insured. You don't need to be, you don't need to have a job. You don't need to pay anything. If anybody tries to charge you, don't pay. It's a scam. It's free for everybody. Go ahead and get vaccinated. We're also looking at partnering with small and larger businesses for incentives around vaccination. Many of them are live up and going around the state. You'll see different concerts and events where you get drink tickets or a gift certificate. We're going to be rolling out more of those going forward, just to provide a little extra impetus for why should I do it now, and get folks who might be a little bit hesitant to say, you know what, if I stop putting it off, I can get $50 or $100 and free cup of coffee, free drinks, whatever it is on the site. We're very excited about that as well. Now, the moment you've all been waiting for. We are going to introduce our $1 million winner. Our next $1 million winner is Heidi. Heidi spent the last 3 years wearing a lot of hats, a stay-at-home mom to 3, and as of very recently, a mom of 4. She has a 2-week-old baby girl. Like many parents, she had to suddenly become a homeschool educator, full-time babysitter. When schools went remote, she works at her husband Randy's oral and facial surgery practice, and she was able to get her first dose of the vaccine in February. She's confident in the science behind vaccines, and as she told us, if everyone does their part, we're all a little better off. Now that she's vaccinated, Heidi's looking forward to visiting family across the country. Now with an extra $1 million, she told us she intends to finally pay off her student loans once and for all, and then she'll start making plans for a brighter future. 4 kids are expensive, so that's a good head start for them. I will now reveal this week's winner with a check, and then we'll introduce Heidi. There we go. Congratulations, Heidi. We'll turn it over to you.
Thank you. I'm usually not a person that's very scared, but this is very intimidating. I'm still in a little shock. I've only known about this for 24 hours, and it still doesn't feel real. But thank you, Governor Polis, and to everybody on his team. My husband and I moved to Colorado 7 years ago. We love it here, and we moved here to buy a business, and because of that business, my husband couldn't join me today. But like Governor Polis said, we have 4 children, and love them. My husband was able to get the vaccine in December, and I was able to get it in February because of our jobs. We are just very grateful for the brilliant minds of scientists, researchers, manufacturers, government leaders that have enabled this vaccine to come to fruition. To create a safe and effective vaccine in less than a year is a miracle. Having 3 school-age kids this past year was difficult, to say the least. We are excited to get back into school full-time and gain some sense of normalcy. I recognize that hitting our state goal of over 70% of adults being vaccinated has helped us to accomplish this goal. This prize will be so helpful in raising 4 kids. When I told my daughter yesterday, her first comment was, "Yes, my college is paid for." But I also look forward to helping others and serving others with this money. I don't know if there's a big enough word to say thank you, but with that being said, thank you, Governor Polis. I appreciate this.
You know, and as Heidi indicated, we just owe so much to the scientists who developed the vaccine, the men and women who stepped up and said, I'm willing to be on a trial for the vaccine, right? Not knowing if they were going to get the vaccine or were going to get a placebo. Hundreds of thousands of Americans, including thousands of Coloradans, stepped up, signed up for trials to prove that the vaccines, all 3 that are now approved and others that are still in the process, but all 3 that have been approved are safe and effective. It took hundreds of thousands of Americans to do. So thank you to the scientists, to those who signed up, to everybody who worked hard to really deliver these 3 vaccines in record time to the people of Colorado. And we are so fortunate to be able to get vaccinated. There's other parts of the world where they don't have enough. Very few people are vaccinated. The virus is still ravaging the population and causing many, many deaths and hospitalizations. We have the tools to end that here. And I encourage the rest of Coloradans who haven't had a chance yet to get vaccinated. This is also a especially exciting day for some of our young Coloradans who are winners of $50,000 scholarships because they, like 43% of their fellow 12 to 17-year-olds, said, yes, I want to get protected. And of course, as Tara mentioned, we're now focused on increasing the percentage of 12 to 17-year-olds before we get back to school. Let me welcome up Megan, Lily, Delaney, and Quentin. Thank you for joining us. We'll also have one winner joining us virtually here today. First, I'd like to introduce Megan from Loveland. Megan, raise your hand so people can see who. Megan is from Loveland. She likes to run, and now that she's vaccinated, she looks forward to hitting the ground, literally and figuratively. She's excited to spend some time out on the beach at Carter Lake, and I think we can all relate to feeling some cabin fever after a long time spent cooped up in the house. And Megan, I hope you have a great summer in the great outdoors. And you're entering your junior year, is that right? Senior year, and she hasn't decided what to study or where to study it yet, but this $50,000 I'm sure will open up doors and help give you the ability to make a choice based on what's right for you rather than what would fit in your budget. Next we have a young winner, Lily. Where's Lily? Lily is 12, and as I pointed out to her and her dad, when a 12-year-old wins, it'll probably be $60,000 to $70,000 by the time they start college, because this does get invested in a college invest account, and it should be more than just the $50,000 by the time they go to college. Lily just moved up to Windsor from Lakewood, and starting a life in a new area can always be tough, but Lily moved right in. She plays soccer. She's vaccinated, so she can visit her cousin in Texas safely, and she's looking forward to going to Disney World. And maybe Disney enthusiasts will experience her own imagination as one of the park's Imagineers, one of the things she might want to do. She also is excited to become a big sister this fall, and of course she's going to be a great one. And Lily, we're so glad that you will be able to pursue your dreams with this $50,000 or hopefully even $60,000 or $70,000 when you need it, so congratulations. Delaney from Frederick. Delaney was at volleyball practice when her folks told her that she had won $50,000. Like a lot of us, getting shots isn't her favorite activity in the world. Actually, she doesn't like getting shots at all. But I want to thank you for being willing to do that and get protected. Delaney is making plans to go to cosmetology school, and she can put the $50,000 towards the preparation that she needs to have a successful practice. And Delaney, I can't wait to see where your entrepreneurial business spirits take you, and we really wish you the best with your ongoing education. Congratulations. Next, Quentin from Boulder. He just found out he won, like a few hours ago, I guess. Is that right? And came here. He's looking forward to being able to hang out with friends, playing football. He loves math. He's thinking about maybe pursuing a degree in architecture. He's 13, so he has some time to decide what he wants to do. Certainly the $50,000 will help him in whatever he decides to do. Getting vaccinated was the top of his to-do list because it meant he could see friends, go back to school without worrying about it, and of course, he wanted to feel good about helping to save the lives of others. Quentin, I can't wait to see how this scholarship money helps you pursue your goals. And in the meantime, I hope you have a great time with your friends this summer. Congratulations. We now have a winner joining us virtually from Greeley, Zirisine Tsige. Zirisine is involved in track and cross country. He's thinking about studying business. He got vaccinated to protect his family and community, including his mom, Mirchet, who works at JBS in Greeley. And as we might recall from the early days of the pandemic, there were 6 of the workers there that actually died from COVID-19, many others that were hospitalized. Now Zirisine and Mirchet thankfully don't have to worry about the pandemic, and he doesn't need to worry about getting sick. And I want to congratulate you, Zirisine. So congratulations to you and good luck in your future. He and the others will be available for questions as well. And, I want to point out that it really, not just these 5 young people, but everybody who gets vaccinated is a winner. The biggest winner of all is your health. You can't put a price on health. It's worth a lot more than $50,000. It's worth a lot more than $1 million. If you don't have your health, you don't have anything. And having lost 2 friends to COVID and had many more that have had hospitalizations and a tough time, I've got to see some of that loss firsthand. And I'm here to say that it's no longer necessary. We have highly effective vaccines which will protect you from COVID. If you do contract it, it's a much more minor case. Dr. Fauci rolled out some statistics the other day. At this point, 99% of the deaths in our country from COVID are people that are unvaccinated. Even though we have more than half the adults vaccinated, fully vaccinated in our whole country, 99% of the deaths are unvaccinated, preventable. And it's really up to us to take that step to do it. Congratulations to Heidi and Randy. Congratulations to our students, and congratulations to everybody. With that, we'll happy to open it up for questions. And I think we'll be joined by General Sherman, Tara, and Jill. We're also available to take questions for, we're going to present these first. Okay. Megan, here we go. Congratulations. Lily. Delaney. Quentin. And Zirisine, we have one for you too. Okay, we'll get that up to you in Greeley. And as I told them, these are not the checks you actually cash. Same goes to you, Heidi. You can't take that into a bank. But it makes a good souvenir. I never thought that, in being governor, I would be projecting my inner Ed McMahon in delivering these. For people of my generation, that means something. And with that, we're happy to take some questions. And we're joined again by the General, Jill, and Tara. Yes?
Sorry, if I can ask you an unrelated question, Governor. And this is also for Jill Hunsaker-Ryan, if you're able to answer this as well. You signed the ketamine bill yesterday. In 2020, the health department said patient safety and program transparency are top priorities when they announced that they would be doing their own ketamine review. But since then, they've avoided providing any clarity or guidance from the public when the public has had several questions about questionable cases that we've uncovered. Why hasn't the state been more transparent on this issue?
I'll go to Jill on that.
Thank you for the question. So we don't comment on individual cases that we're investigating, but as you know, we are currently in the midst of doing a complete review of our ketamine waiver program. The review includes several experts. It's taken many months, but we believe it will be finished in July. It's very thorough and has very good recommendations to assure the safety of the use of ketamine in the field, in the EMS setting. At that time, we will certainly provide information about the review in addition to interviews.
How do you think, though, that the lack of talking about this issue, even the guidelines that were already in place, has helped the public understand this issue, as we've uncovered several people with lots of questions, including some deaths that may not have ever been reported to the state? How is that helping the public? Not
You know,
talking to the public?
I think this review process will prove to be very transparent and very helpful to the entire EMS system and administering this drug, and also in conjunction with the recent bill that passed. It's going to be a complete revamping of the program, and it's why we have asked EMS agencies to curtail their use of ketamine until we're able to put the appropriate protocols in place, and we will be providing information about those protocols within a few weeks.
And Governor, are you able to say whether you're satisfied? How satisfied are you with the way that the health department is handling this?
Well, like many Coloradans, I'm very much looking forward to the results of the report. And it's important to take the time to get it right, but not take so much time that it causes additional difficulties and suffering. And I'm confident the report will be released in the next few weeks, and I look forward to reviewing it along with the rest of Colorado.
Hey, Governor, Mike Konopasek, reporter, Fox 31 Denver. My question relates to the COVID-19 Delta variant in Colorado and the upcoming All-Star Game events. Many people will be coming to Denver from across the nation. How much of the variant is known to currently be here in Colorado, and what steps are being taken by the state to ensure less spread during these All-Star Game events?
So in western Colorado, in Mesa County, it's one of the national epicenters of the Delta variant. Unfortunately, it's one of the areas with the lowest vaccination rate in our state. We're doing everything we can, working with local health officials and local elected officials to increase it. Across our state, it's roughly half of cases. I believe it's north of 80% in Mesa County. We'll be happy to get you those exact numbers. The All-Star Game is outdoors. I would certainly, if people are not vaccinated, I would not recommend they attend the game. I think people who are fully vaccinated should feel free to attend it without worry. But I would be concerned, if people choose to attend the game who haven't been vaccinated. It's outdoors, it's lower risk, but there's going to be a lot of people there and a lot of crowding indoors in the food areas and bathrooms, and just encourage people to be safe. And if you do go and you're not vaccinated, I would recommend you wear a mask when you're in those indoor areas around others.
You mentioned earlier these new programs like getting people drinks and things along those lines, but then you also just brought up Mesa County. Do you have programs that are going to kind of specifically target different geographic parts of the state moving forward from this program today?
So one of our mobile bus units is detailed 100% to Mesa County. So it's going around to really almost any event that will attract people in the area. And yes, we're looking at different kinds and have been offering different kinds of gift certificates and incentives on the spot to do it. It's a matter of convenience. It's a matter of encouraging people to do it now rather than keep putting it off. And in areas of the state with lower vaccination rates, we have a particular focus on trying to make that happen.
Any plans for any more programs that you can kind of be specific about other than
Yeah.
the drink incentive?
We'll be rolling out and announcing as they're launched specific incentive programs, but they are occurring and will be occurring in different parts of our state, and we'll be announcing those corporate partners and how those work and how people can take advantage of those.
Last question, Jesse?
Governor, the state spent more than $6 million on the vaccine sweepstakes. I'm wondering if you feel like we got an adequate return on investment on that, and if you can provide any information about how much money is left over for the additional projects that you want to launch, if there's enough money to continue.
Yeah, the federal government through the CARES Act was very generous in funding the successful distribution of the vaccine, not only making the vaccine free, but funding our bus program, our public outreach campaigns, specifically allowing the use of a drawing, which we and a number of other states used. Certainly you could, there's sort of PR professionals that can calculate the value of the earned media around a giveaway. I'm confident it's north of $6 million. I think it was a really well publicized effort, and many people know about it in our state and probably factored into the decision making of some to get it a little sooner rather than later. But we're doing all of the above. So it's $50 and $100 giveaways, which we have been doing. We're going to do more of. It's the drawings, which have now come to an end. It is accessibility and convenience, meaning in your neighborhood, mobile station, your local pharmacy. How can it be easy for you? So it's not something you have to, drive a long way to or wait a long time for. Our super sites were also federally funded. The last of those is closed, but we delivered close to over 14% of all the doses in the state were through our 6 major super sites, which were also federally funded. And we no longer need them because we've gone through a large part of the population. As I said, it's going to be harder to get from 70 to 80 than it was to get from 0 to 70. I'm confident we'll do it. A lot of those gains, we also need to make gains in the 12 to 17-year-old age group, and we'll look forward to incentives that are relevant and exciting to 12 to 17-year-olds as well.
Governor, would you answer a quick question about AB 1209, which was the people getting out of prison at age 21 after 20 years bill? You signed it privately.
Mhm.
I was wondering if you could explain why and whether, what you say to the critics who say the government is being too light on violent criminals.
Is this the one where after after 20 or 30 years and they go through a program? This was an existing, is this the right bill? So is that the one? We'll probably just give you a statement on it, but because I want to make sure I'm talking about the right bill. But if it is, it was a program that it was a pre-existing program with great success for people that were under 18 when they committed their crime. Now that's being extended to people that are under 21 when they commit their crime, and they have to go through a very rigorous process. It's a very limited number of people, and it provides a way that they can pay their dues to society and after several decades be able to successfully re-enter society. And it's had good results for the people that are under 18. Thank you.